I'm Christine. I work for the Ottawa Health Services as a nurse case manager for oncology patients. When we have patients here in Ottawa for cancer care, then my job is to facilitate that care, to make sure they get the right care, to support the patient in any way that I can. An Inuk will be staying at Lagerbaffin House, which I know is, being in Ottawa is difficult because it's miles and miles away from home and family and community. But Lagerbaffin House tries to be as home-like as possible. And so I visit patients there. I try to do everything I can to facilitate the care that people get down here and to make sure they understand the care that they're getting and that they are understood and that their wishes and needs are met. We have 6 interpreters that go with you to your appointments and who will interpret for you. And then afterwards I can explain with an interpreter what the doctor said, because it's not always easy to understand it all when you're at the appointment. When you're at the cancer center, there is a team of specialists, not just doctors and nurses, but also social workers and mental health workers, all who you can be referred to, so that we try and take care of you in every way while you're in Ottawa. It's certainly overwhelming for anyone, even if your mother tongue is English, it's overwhelming, the language of cancer. I find most of the doctors at the Cancer Centre here in Ottawa have looked after many of our patients from the north, and they're quite sensitive. They understand some of the issues of how hard it is to be away from home. So our interpreters understand that, and I think so do the physicians. And then what might happen in a day or two, when I've seen the doctor's report, then I would go to Largo and talk to the patient and with an interpreter and say, what do you think the doctor told you? And see what the patient has received from that meeting. And then I can further explain and reinforce what the physician has said. There are many words that there is not an Inuktitut equivalent. So to have this glossary that we can use, that our interpreters can use, is very encouraging and exciting.